It's extremely challenging to have political interference in the patient-doctor relationship.
Dr. Kyle Bukowski is the chief medical officer for Planned Parenthood of Maryland and an obstetrician and gynecologist.
People are relying on this concept of protecting the health of the mother as being an exception for some of these bans that are going into place across the country. But in reality, they're extremely hard to interpret and enforce real time.
He says doctors in some states are asking how they are supposed to manage people when there is the threat of criminalization of basic health care. For example, an ectopic pregnancy, which is a pregnancy that implants outside the uterus in the fallopian tube, can be life-threatening because it will rupture and cause internal bleeding as the pregnancy grows.
For a lot of people, especially if the pregnancy is undesired, if we don't know where the pregnancy is, we will sometimes do a suction procedure to identify was the pregnancy in the uterus or in the fallopian tube so that we can treat and identify an ectopic pregnancy before it becomes a medical emergency. With these new laws, we're not able to do that anymore.
He says the laws also cause difficult choices for cancer patients.
Their medical oncologists will not start their chemotherapy or radiation while they are pregnant. And so these patients will come for a procedure so that they can get the cancer treatment that they need to continue to take care of the children that they already have.
The president of the American College of Obstetricians and Gynecologists says the restrictions put forth are not based on science nor medicine. They allow unrelated third parties to make decisions that rightfully and ethically should be made only by individuals and their physicians.
And it's really the chaos and the cruelty and the callousness of these bans that don't take into account the nuance of medical care that is most upsetting.
Lisa Robinson, WBAL TV 11 News.